Hi all of you. Today we are in conversation with Dr. Lubhana Malik.
Hi viewers, I'm Dr. Lubhana Malik. I have been doing psychotherapy for the last 10 years now. I work with couples and families, and I do individual work with children, adolescents as well as adults. The work that I do has a lot to do with couples and family issues, as well as adult issues dealing with stress, anxiety, anger, trauma, and also with children and adolescents for issues of trauma or grief, emotional regulation problems, peer pressure, and body image. I also work with drug and alcohol de-addiction.
My first question to you is that nowadays we see a lot of problems that couples face before and after having a baby. So what do you think should be kept in mind before planning a baby and when to actually plan a baby?
Before planning a baby, I think it's one of the most important aspects is to stabilize the foundation of a relationship for a couple. So whether you've been dating or whether you had a courtship, it's extremely important to stabilize your relationship. Take 1 or 2 years to get to know your partner, because every relationship goes through a different phase after dating or courtship when you get married. So before having children, it's very important to stabilize your relationship. Another aspect is also to talk about among the partners, to talk about how they are going to be taking care of the child in terms of role sharing, or in terms of what the input is going to be of each parent. It becomes very important that these issues should be ironed out before you have a child.
What do you think are the major issues faced by parents?
I think after having a child, parents constantly have issues in the first few years regarding a lack of time for their partner. That becomes one of the biggest reasons why there are conflicts in couple dynamic, relationship dynamics after they have children. The other reason is also mothers tend to feel a huge amount of guilt when they go back to work, leaving their child back at home. It doesn't happen so much with the father, because as a community we are open to that, but mothers go through increased amount of stress and they feel a lot of guilt because of that. Another aspect that couples face as a problem is, I think, balancing the dynamic between their relationship, a baby, family, work. I think balancing all of that becomes sometimes challenging or stressful for parents.
As we have seen nowadays that couples move into the decision of separation quickly. So how do you think this affects a child? What is the traumatic situation that a child goes through while parents separate?
Whenever parents get separated, it is definitely a traumatic situation for the entire unit of the family. From the parents to the children to the grandparents, everybody goes through a certain amount of trauma. Definitely children feel the trauma of the separation as well. How children feel that trauma is differentiated, and it varies depending on the age of the child. So for instance, if a child is under 9 years of age, children will tend to regress more back to an earlier age. So children will become more clingy, they'll want to be more with their parent, they feel a lack of love and they want to be connected back to their parent. For children above 9 years of age, there is a lack of trust that they feel with their parents. There's a huge amount of mistrust that they feel with their parents, because they feel that their parents are probably abandoning them. There are a lot of issues that come up with insecurity.
You are a psychologist practicing for a very long time. So what are the various issues or very surprising issues that you have faced?
Well, looking at the changes that have happened in India over the past decade or two, I don't think that there are any changes, psychological issues that we are going through that are different from what one would have expected. Because of the changes that are happening in the society, because of how we are becoming so work oriented while being connected to the family, the issues that are happening, whether in adults or whether in children, are all expected issues. So I don't think that there's anything that actually surprises me from the kind of clientele that I see.
So there are a lot of cases where we can see that nowadays every second child is suffering from the problem of anxiety, depression or stress. So what do you think is the major reason for this problem, or how can these problems be dealt with?
So the reasons for problems such as anxiety or depression or stress in children are probably the same that there are for adults. As I was mentioning earlier, in terms of work stress, added with the family lifestyle, and how families are now becoming more independent, more nuclear, and even in joint families the sense of support is still lacking, which is why I think all the parents seem to be going through a lot of stress, anxiety, and depression. And what happens is that when adults go through this kind of varied emotions and feelings, these translate into stress and depression and anxiety for children as well. And so generally that is what happens, that if parents are going through a certain feeling, chances are that their children will also tend to feel similar feelings.